A patient got you a gift for your excellent care. What would be your action? I'd thank them sincerely, then check our policy. If it's allowed, I'd accept it gratefully. And if it's not, politely decline.
A patient questions your care. What do you do?
I would listen empathetically to their concerns, then explain my actions clearly. If needed, I would consult a colleague.
Excellent. Clear communication is key.
Thank you.
So tell me, what would you tell other men to join nursing?
I would say it's a very rewarding career. You get to help people every day.
Good. What else?
The career growth is great, and we need more men in the field.
Vitals are stable, but patient still complains of feeling unwell. What will be your next action? Let's reassess. I'll order a blood panel and get an EKG. Good. I'll monitor them closely.
A manager gave you a negative feedback. How would you take it?
I would take it constructively and ask for specific examples to improve. It's a chance to learn and grow professionally.
That's a great attitude.
Why are the skills needed as a mental health nurse?
Mental health nursing requires empathy, active listening, and strong communication to build trust.
And how do you handle difficult patients?
Patience and de-escalation techniques are crucial.
What if measures used to de-escalate violence from patient fails?
We'd immediately call for backup and isolate the patient for safety.
Good, and review the incident. Exactly. Team safety first.
How do you ensure patient privacy during an audit?
We verify all PHI is de-identified and access logs are reviewed.
Excellent. And the follow-up, we confirm corrective actions.
To summarize, the patient has an increased respiratory rate, low oxygen saturation, and a high heart rate. These are the main concerns. I'll now calculate the NEWS2 score. The NEWS2 score is 7, which is high. This needs urgent escalation. I will document this now.
Working alone or with a team, which suits you best?
I prefer working with a team. It brings diverse ideas and support.
That's great to hear. We value collaboration.
I'm excited to be here.
How do nurses remain compassionate without becoming emotionally exhausted?
It's about setting boundaries. Empathy is key, but self-care is crucial. Wise, balance is everything.
It is.
You strongly suspect abuse, but the patient denies everything. What do you do next?
I would document my suspicions thoroughly and report it to the authorities. It's mandatory. Then I would try to build trust with the patient, let them know I'm there to help when they're ready.
Good, that's the right balance. Let's discuss NSTEMI. It's a type of heart attack where the artery is partially blocked. On this monitor, you'll see elevated troponins, but no ST elevation.
So it's harder to diagnose?
Exactly. That's why we rely on serial blood tests and close monitoring.
How do you show evidence-based practice in care?
We use current research to guide our decisions. We also consider our clinical expertise.
And we incorporate patient preferences. That's evidence-based values.
Pain is whatever the patient says it is. Do you fully agree?
Yes, I fully agree. Pain is subjective.
Good.
That's the right approach.
It's about empathy and listening.
All right, team, red flags for CPAP and BiPAP. First, worsening hypoxia or consciousness.
Like dropping sats or confusion?
Exactly. Also, facial trauma or aspiration risk. Got it. We'll monitor closely.
Let me just remove my gloves and do hand hygiene. Hello, my name is Emma. I'm a student nurse. I'd like to complete an assessment. Is that okay?
Yes, that's fine.
Let me just remove my gloves and do hand hygiene. Hello, my name is Emma. I'm a student nurse. I'd like to complete an assessment. Is that okay?
Yes, that's fine.
How do you maintain your passion for nursing over time?
I remind myself of the patients we've helped. That keeps me going.
That's a great perspective. It's easy to forget.
It is. We have to.
What motivated you to become a nurse? My grandfather was sick, and the nurses made all the difference. I wanted to do that. That's a wonderful reason. It's a calling. It is.
Describe your self-care checklist, and how do you manage?
It's a daily list, hydration, a quick walk, and a gratitude note. I fit it in during breaks.
That's a great approach. How do you track it?
A simple app on my phone.
Let's review catheter care. Wash your hands in the area daily.
Okay, I can do that.
Good. Watch for red flags, fever, blood, pain, cloudy urine.
What if I see those?
Call your doctor right away. Here's the number.
Why did you apply for this nursing job?
I was drawn to the opportunity to work in a hospital where I can make a real difference in patient care. I also admire the hospital's commitment to professional development.
Team, key points for a crash call.
Go ahead.
First, confirm unresponsiveness and call for help.
Got it. And CPR?
Yes, 30 compressions to 2 breaths. Watch.
Noted.
How do you mentor the next generation of nursing leaders? I listen to their goals, then provide tailored guidance and opportunities to lead. Hands-on experience builds their confidence and skills.
How do you handle a situation where a doctor's order is unclear?
I would first clarify it with the doctor. Patient safety is the top priority.
Good. And if they're unavailable?
Consult a senior nurse.
You escalated a patient and nothing is done. What will be your next action?
I would re-escalate to the charge nurse and document everything.
Good. And if it's still unresolved?
I'd contact the attending physician.
When is restraint legally and ethically justified?
When there's an immediate risk of harm to the patient or others and less restrictive methods have failed.
And we need an order for it, right?
Exactly. And we must document it thoroughly. High-risk patient walks out. What should happen next?
First, ensure staff safety, then attempt to verbally redirect the patient back inside. Simultaneously alert charge nurse and security for assistance.
And if they refuse?
Unmonitor.
How do you remain objective during a heated argument?
I focus on the facts and the patient's needs, not personal feelings.
Good.
And how do you de-escalate? by listening and finding common ground.
During surgery, senior staff are yelling. Does this affect patient safety? It can if it causes distractions, but good teams refocus. And if it persists, I'd speak up. Safety first.
Access site continues bleeding after dialysis. What's your first priority?
Apply direct pressure to the site and monitor for signs of hypovolemia.
How do you motivate a team that is experiencing low morale? I would start by talking to them individually to understand their concerns, then hold a team meeting to address issues and set clear goals.
Good. How would you follow up?
How do you educate a patient on a complex clinical procedure? I use simple language, visual aids, and check their understanding.
Good. And for follow-up?
I provide written instructions and schedule a follow-up call.
So your colleagues are discussing a patient inappropriately. What would you do?
I would remind them that we can't discuss patients in public areas. It's a privacy violation.
And if they continue?
I would report it.
Good.
Have you ever struggled with patient care, and how do you cope?
Yes, in the beginning, I found it overwhelming. I cope by talking to my team and focusing on one patient at a time.
That's a great approach. How do you handle a situation where a doctor's order is unclear?
I would clarify it with the doctor directly to ensure patient safety.
Good. And if the doctor is unavailable, consult a senior nurse or follow protocol.
A colleague skips hand hygiene during a busy shift. Do you challenge them or let it go? I would challenge them. Patient safety has to come first.
And how would you approach that?
I'd speak to them privately.
How do you handle a clinical task you feel unqualified to perform?
I would immediately inform my supervisor and decline to proceed until I get guidance.
Good. And then?
Then I'd observe and document.
Small actions, tone, attitude, presence, do they really impact patient outcomes?
Yes, absolutely. Those small actions build trust and comfort, which directly improves recovery and outcomes.
Exactly, a vital reminder.
How do you maintain aseptic technique in a chaotic environment?
I always follow standard protocols like double-checking my sterile field and using PPE correctly.
And I stay calm by focusing on one task at a time. Good. And under pressure? Older patient denies pain, but grimaces during movement. What's the real assessment?
We should reassess. Maybe the pain is worse with movement.
Exactly. Nonverbal cues are key. I'll check the orders and monitor closely.
Patient takes medication from you and pours it away. What action would you take?
I would stop them, explain the importance of the medication, and document the refusal.
Excellent. Always follow up and inform the doctor.
A patient asks for your phone number after discharge. Where do you draw the line?
I would politely decline. It's important to maintain professional boundaries.
That's correct. Good.
How do you manage burnout and stress related to work?
It's important to recognize the signs early. I make sure to take short breaks, talk to colleagues, and maintain a healthy work-life balance.
Why is it important to document patient care?
It's crucial for continuity of care, safety, and legal reasons. It ensures everyone is informed.
That's an excellent answer. You've clearly grasped the key principles. Explain how you would handle a dismissive and unsupportive team leader.
I would address it privately, explain the impact, and find a compromise to keep patient care first.
That's a strong approach. You will pass the exam if you recognize deterioration, calculate news to, communicate professionally, escalate concerns appropriately, document correctly.
Some patients express pain loudly, others stay silent. Can culture affect pain assessment?
Yes, absolutely. Some cultures teach stoicism, so they underreport pain.
That's a crucial insight. We must be culturally aware.
I agree.